Hello everyone, Assalamu alaikum. I am Dr. Khairul Kabir. Today we will discuss about a rare and important hematological disorder which is Paroxysmal Nocturnal Haemoglobinuria. So let's begin. What is Paroxysmal Nocturnal Haemoglobinuria? In general, it is a rare blood disorder that named for a single symptom, red, brown or dark urine, noticed during the late night or early morning. Paroxysmal means sudden, nocturnal means night, and hemoglobinuria refers to pee stained with blood. When your pee is dark because your immune system is breaking down your red blood cells, so healthcare providers call this hemolysis. In medical perspective, it is a rare acquired blood disorder that happens when your part of immune system attacks and damages your red blood cells and platelets. If left untreated, PNH can cause hemolytic anemia, mainly intravascular, chronic kidney disease and thrombosis, which is blood clot. So who does it affect? Kara kara beshi affected hocche? About 6 per 1 million people are diagnosed with PNH each year. This condition affects men and women between the ages of 30 and 40. 30 থেকে 40 বছরের মানুষদের মধ্যে বেশি affected হচ্ছে. Women are slightly more than men through developed PNH. মহিলারা বেশি affected হচ্ছে. Often, people who have bone marrow disorders like aplastic anemia or myelodysplastic syndrome develop paroxysmal nocturnal haemoglobinuria more. What is the difference between hemoglobinuria and hematuria? Both conditions cause blood in your urine. The difference is, hematuria is the presence of red blood cells in your urine, while hemoglobinuria is the presence of only hemoglobin in your urine. Hemoglobin is a protein in your red blood cells that makes blood look red. In PNH, there is classically dark-colored urine in the morning because our urine becomes more concentrated during the sleep, although that have been shown to occur throughout the day. সারাদিনেই অল্প অল্প করে ইউরিনের মাধ্যমে এক্সক্রিটেড হবে হিমোগ্লোবিনিউরিয়া, বাট ঘুমানোর পরে এই সারা রাত ঘুমানোর জন্য কনসেন্ট্রেটেড হয়ে গেছে ইউরিন, এই জন্য ওই সময় স্যাম্পলটা আমরা বেশি পাবো। Urine is positive for blood, which is hemoglobin, but there is no red blood cells. What is the pathophysiology behind paroxysmal nocturnal haemoglobinuria? It is thought that it is caused by increased sensitivity of the red cell membranes to complement due to lack of glycoprotein, glycosyl phosphatidylinositol (GPI). GPI is thought as an anchor that attaches surface proteins to the cell membrane. This defect arises from an acquired somatic mutation in the X-linked phosphatidylinositol glycan class A gene, which is PIGA, with subsequent clonal expansion of the mutated hematopoietic stem cells, which is HSC, whose surfaces lack all the proteins such as delay accelerating factor CD55, DAF, and membrane inhibitor reactive lysis CD59, which is MIRL, that links through the glycosyl phosphatidylinositol GPI anchor. Complement regulating surface proteins such as delay accelerating factor DAF are not properly bound to the cell membrane due to lack of GPI. As a result, the RBCs are sensitive for destruction while complement and platelets are activated. This caused intravascular hemolysis with dark morning urine and recurrent thrombotic events. Thrombosis is thought to be caused by lack of CD59 on platelets membrane, predisposing to platelet aggregation. Some clinical features we must know about PNH, which are hemolytic anemia, pancytopenia, RBC, WBC platelets or stem cells that may be affected, aplastic anemia, which develop in some patients, hemoglobinuria, as we discussed it earlier, then abdominal pain, which is a common symptom and may be due to small mesenteric vein thrombi. স্মল মেসেন্টারিক ভেইন থ্রম্বোসিস হওয়ার জন্য ভেসেলটা অক্লুডেড হবে, তো যার কারণে ওই এরিয়াতে অ্যাবডোমিনাল পেইন হবে। দেন থ্রম্বোসিস অর প্রোথ্রম্বোটিক টেন্ডেন্সি such as Budd-Chiari syndrome and DVT or pulmonary embolism, and lastly erectile dysfunction. We need to know about Budd-Chiari syndrome that abdominal pain plus tender hepatomegaly and rapidly developing ascites, which altogether causes Budd-Chiari syndrome. So paroxysmal nocturnal hemoglobinuria is intravascular hemolysis plus thrombosis plus pancytopenia, which is due to bone marrow failure. These three things we need to know about PNH. This picture shows the clinical symptoms of PNH that affects the body: headaches, trouble breathing, blood clots, abdominal pain, dark urine, bruising and bleeding, frequent infections, rapid heartbeat, fatigues and weaknesses. So the question is, can you prevent PNH? No. Because PNH is caused by a genetic mutation, which means you cannot prevent it, unfortunately. As I mentioned earlier in the title of this video that this video has a bonus part, which is paroxysmal cold hemoglobinuria. So what is paroxysmal cold hemoglobinuria? It's a rare type of autoimmune hemolytic anemia that occurs primarily in the children or adolescent. The classic symptoms: sudden onset of hemoglobinuria following exposure to cold, even for a few minutes. Symptoms may occur minutes to hours following exposure to cold. The direct agglutination test, DAT, which is IgG positive and C3 negative. Hemoglobinuria is not always present because in some persons with PCH, the autoantibody level is not high enough to cause intravascular hemolysis. PCH is usually of abrupt onset in the setting of an infectious disease. Here is a picture of an elderly patient's digits which are blackening or darkening due to paroxysmal cold hemoglobinuria. The mainstay treatment for PCH is supportive care and avoidance of cold exposure. Warmed packed red blood cell transfusion are used for life-threatening hemolysis and symptomatic anemia management. There is a sample question for MedQ lovers. A male patient, 35 years old, comes to ER or emergency department with shortness of breath, pallor, history of DVT, on warfarin for 6 months, dark urination in the morning. His lab tests are hemoglobin is 6.1, total count of WBC is 3, platelet count 65,000, there is increased Rolex formation, urinary examination shows blood 3+. So what is your diagnosis? So thank you and subscribe to my MedQ channel and keep supporting me. If you have any questions, please write down in the comment section. Thank you.